Are you taking metformin but finding yourself running to the bathroom more often than usual? If so, don't ignore it. Diarrhea is one of the most common side effects of metformin, and for some people it becomes so frustrating that they reduce their dose, skip doses, or stop treatment altogether. But before you do that, there's something important you should know. In this video, I'll explain why metformin causes diarrhea and share practical tips that may help reduce this side effect and improve your tolerance to treatment. As a clinical pharmacist, my goal is to provide trustworthy medication information that helps you use your medicines safely and effectively. Now, you might be surprised to learn that gastrointestinal side effects are among the most common problems reported with metformin. In some studies, up to 75% of patients reported gastrointestinal symptoms, and diarrhea is one of the most frequently reported side effects. So, why does metformin cause diarrhea? The exact reason is not completely understood, but researchers believe metformin affects your digestive system in several different ways. One reason is that metformin can increase the movement of your intestines. Normally, food travels through the digestive tract at a controlled pace, giving your body enough time to absorb water from the stool. But when food moves through the intestines more quickly, less water is absorbed. As a result, stools can become loose or watery, leading to diarrhea. But that's not the only reason. Millions of bacteria that naturally live in your gut, often called the gut microbiome. These bacteria play an important role in digestion and overall gut health. Researchers have found that metformin can also change the balance of these bacteria that naturally live in your gut. While some of these changes may help metformin lower blood sugar, they may also contribute to symptoms such as diarrhea, bloating, gas, or stomach discomfort in some people. And there's another possible explanation. Metformin may increase the amount of bile acids that remain in the intestines. Bile acids are substances made by the liver that help your body digest fats. When larger amounts stay in the bowel, they can draw more water into the intestines, making stools looser and increasing the risk of diarrhea. Researchers also believe that metformin can increase the levels of certain gut hormones, including a hormone called GLP-1. These hormones help the body control blood sugar and play an important role in digestion. Also, these hormones can slow down how food moves through your intestines and affect the amount of fluid in your gut. As a result, some people may develop diarrhea and other digestive side effects. So, increased intestinal movement, changes in gut bacteria, higher levels of bile acids, and changes in gut hormones may all work together to cause diarrhea in some people taking metformin. The important point is that this does not mean metformin is damaging your intestines. It simply changes how your digestive system functions. Now, two of the most common questions patients ask are, when does metformin-related diarrhea occur, and how long does it last? For many people, diarrhea develops soon after starting metformin or after increasing the dose. However, not all cases occur early in treatment. Some patients may develop diarrhea months or even years later despite previously tolerating metformin well. This is known as late-onset diarrhea. The good news is that in many cases, the symptoms are temporary and improve within a few days to a few weeks as the body gradually adjusts to the medication. However, this is not the same for everyone. In some patients, diarrhea may become chronic, meaning that loose stools continue beyond the first few weeks instead of improving over time. So, metformin-related diarrhea can occur shortly after starting treatment, after a dose increase, or even much later during treatment, and its duration can vary from temporary to chronic depending on the individual. Now, how do you know if metformin may be the cause of your diarrhea? You should suspect metformin if the symptoms started soon after beginning the medication or after your dose was increased. Another clue is if the diarrhea improves when the dose is reduced or when you take the medication with food. You should also consider metformin as a possible cause if other explanations, such as an infection, a stomach bug, or recent dietary changes, do not seem to explain the symptoms. Of course, diarrhea can have many different causes, which is why it's important to discuss persistent symptoms with your healthcare provider rather than making changes to your medication on your own. But here's the good news. In many cases, you don't have to stop metformin to improve these symptoms. There are several practical strategies that may help reduce or even prevent metformin-related diarrhea, and some patients notice a significant improvement after making just a few simple changes. Let's go through them one by one. One of the simplest and most effective ways to help reduce metformin-related diarrhea is to take the medication with food. In fact, here's something many patients don't realize: taking metformin in the middle of a meal may be better tolerated than taking it after you've finished eating. Why? Because the food can help slow down how quickly the medication reaches your digestive system, which may reduce irritation and make gastrointestinal side effects such as diarrhea, nausea, and stomach discomfort less noticeable. If you're taking metformin on an empty stomach, or even after you've finished your meal, talk to your healthcare provider about whether taking it during a meal may help improve your tolerance. If you're still experiencing diarrhea despite taking metformin with food, another strategy that may help is asking your doctor about extended-release metformin, sometimes called ER or XR metformin. Many patients don't realize that metformin comes in different formulations. The standard form, known as immediate-release metformin, releases the medication more quickly after you take it. In contrast, extended-release metformin releases the medication more slowly throughout the day. Its slower release may improve digestive tolerance and causes less diarrhea in some patients. So, if metformin-related diarrhea is making it difficult for you to continue treatment, it may be worth discussing with your healthcare provider whether an extended-release formulation is appropriate for you. Another important strategy is to start with a low dose of metformin and increase it gradually over time. One reason some patients experience diarrhea is that the digestive system may not tolerate a higher dose right away. Starting with a lower dose gives the body more time to adjust to the medication. That's why healthcare providers often begin with a lower dose and increase it gradually based on how well the medication is tolerated and how blood sugar responds. If you've recently started metformin or your dose was increased and you're experiencing diarrhea, don't make changes on your own. Instead, discuss your symptoms with your healthcare provider, who can determine whether your dose needs to be reviewed. And if diarrhea continues despite these measures, there is another dosing strategy that may help some patients tolerate metformin better. If you're taking metformin more than once a day, another strategy that may help is discussing with your healthcare provider whether splitting the dose is appropriate for you. Instead of taking a larger amount at one time, dividing the total daily dose into smaller doses taken with different meals may be easier for some patients to tolerate. The idea is simple: a smaller amount of medication reaching the digestive system at one time may reduce gastrointestinal side effects such as diarrhea. However, this is not something you should change on your own. Always discuss any changes to your dosing schedule with your healthcare provider first. While metformin can cause diarrhea, certain foods and eating habits may worsen the symptoms in some patients. For example, some people notice that large meals, high-fat meals, or foods that already upset their stomach can worsen diarrhea while taking metformin. Because everyone is different, eating a healthy food and symptom diary may help identify foods that trigger or worsen your symptoms, allowing you to avoid them. Of course, avoiding dietary triggers will not completely eliminate metformin-related diarrhea, but it may help reduce the severity of symptoms in some patients. Another important consideration is replacing the fluids that may be lost through frequent diarrhea. If you're experiencing frequent diarrhea, it's important to stay well hydrated. Diarrhea can cause your body to lose water and electrolytes, which may increase the risk of dehydration. Signs of dehydration can include increased thirst, dry mouth, dizziness, weakness, or feeling lightheaded. Drinking enough fluids throughout the day may help replace what is being lost and reduce the risk of dehydration-related complications. While mild diarrhea often improves as the body adjusts to metformin, some situations require medical attention. You should contact your healthcare provider if diarrhea is severe, persists for more than a few weeks, causes dehydration, or is associated with symptoms such as dizziness, significant weakness, or unexplained weight loss. You should also seek medical advice if diarrhea develops suddenly after years of taking metformin without any previous problems. Remember, do not stop metformin or change your dose on your own. If you're experiencing troublesome symptoms, your healthcare provider can help determine the cause and discuss strategies to improve your tolerance to treatment. If you found this video helpful, make sure to like, share and subscribe to replace medicine worries with real knowledge.